But a lot of time they are skeptical about it.
It's very difficult for them to visit a therapist or psychiatrist. I see with people a lot of diarrhea, even frequent urination.
You don't enjoy the moment.
Yeah, exactly.
Yes.
So I would like to call it more solution focused, to look perfect, to look beautiful, to look.
I think that has become very important these days.
Discipline with some more flexibility.
Correct. What is depression? Observing people.
That is what will help, also sticking to the medication.
Yes. So does it require help of both a psychiatrist and a psychologist then? Hi, this is Nutritionist Avantii Deshpaande. For general health and well-being, there are 4 pillars which are very, very important. The first one is mental, the second one is emotional, the third one is spiritual, and the fourth one is physical. And of course, nutrition supports all this together. In today's episode, we are meeting a special guest who is a licensed psychologist. Her name is Neha Yavle. My meeting with Neha Yavle was through a community which is Walk It Out, Talk It Out, a very well-running community on Facebook. She has a master's degree in counseling psychology from Monash University and one of the leading counselors in Pune dealing with mental health, eating disorders, and gut health. It's a pleasure to have Neha Yavle today here. The intention of the podcast is going to be to understand the connection between nutrition, gut health, and mental health, anxiety, depression, and its connection to nutrition and mental health, different types of eating disorders that exist, and finally, how you can break the cycle and come out of it to have an overall well-being. Hope you enjoy this episode. Hi Neha, so happy you're here, and there are so many different points which I would like to discuss with you. But the starting point which I would like to open with is as a nutritionist, when I'm practicing, I see that there are a lot of people who need a help of a psychologist, a counselor, or a psychiatrist. But a lot of time they are skeptical about it. Sort of a taboo of going to a mental health specialist. So I would like you to elaborate a little bit more about this, of why it is so important that it has to be a lot integrated. And can you just explain a little more about this?
Yeah, so thank you, Avanti. Thank you for inviting me. And like you said, that there's a big taboo about going to a mental health practitioner. So people might be coming to you with a lot of enthusiasm, but there are times that it's very difficult for them to visit a therapist or psychiatrist. And especially if we are talking about eating, food, so many times there are so many disorders or so many issues which are undiagnosed.
Yes.
So people are thinking that this is just a bad habit, or I'm a bad eater.
Correct.
Or I'm lazy, I cannot work out. So there are so many underlying mental health related issues which actually affect our gut health, mental health, food habits, and even everyday behavior. Correct. Or everyday our lifestyle.
Correct. So that is what I tell a lot of people. You need to see a mental health specialist, or you need to see a counselor or a psychiatrist, psychologist, when it's not that you've not tried enough. It is that you have tried too hard. But I think it is going beyond the scope of you managing yourself. And yes, you need a person to give you a third perspective, so that whatever is the kind of jumbling that has happened, it just opens out for you. Is that the right I hope I'm thinking the right thing?
No, you are thinking very well. I mean, that's a perfect way to go about it. But there are so many times that we don't know when to visit a psychologist. Correct. When to visit a nutritionist.
Correct.
When to visit a psychiatrist, or if there are any other neuro related deficiencies. Right. Or anything else going on with the health.
Yes.
So there's so much of confusion around around all these issues with food and any other lifestyle issues.
Correct. So in fact, a few of my clients I have referred to you, and they are so thankful that they did that, because now they see an improvement in their overall health, because they have taken help of you, a psychologist, a counselor, and then that is what it has just given them a better perspective. So that is the thing.
Yes, and it goes hand in hand.
Yes, it goes hand in hand.
When I am feeling like that there's somebody who needs to, like a professional needs to come in picture. So like somebody like you are a clinical nutritionist, so which is very much needed. So which I cannot handle, or which I cannot follow up, or I cannot give them charts or nutrition, because I am not the one, the right professional.
Correct.
So that definitely goes hand in hand. It's just a matter of we finding out the right time,
Yes.
or we being into that preventive mode rather
Yes.
than that after something has
Correct.
gone wrong and then I'm sending somebody to a nutritionist, or you are sending somebody to a psychotherapist.
Yeah. So I mean, the damage is a little done, and then but I think then also it makes a lot of difference when you are trying to integrate this nutrition, psychologist, and help coming in together. So then that comes to my second question to you is a lot of times you must have seen in your practice like the mental health issue is occurred because of some nutritional deficiency and nothing beyond it. Have you observed this anytime?
I would say this 70% of the time,
Really?
when people walk in into my office,
Okay.
they would be deficient on B12, iron, hemoglobin, D3. So there are many nutrients. So that is the first thing I would always recommend to my patients, to
Right.
go to a doctor, get some tests prescribed, get their thorough blood examination
Correct.
done, like even thyroid, other hormonal issues going on with women like PCOD, PCOS, all of this,
Correct.
put together, it can cause sensitivity.
Correct.
It can, like on the very general level, we can say irritability,
Correct.
sensitivity, low tolerance to heat, cold, dehydration. There are so many things people become sensitive about.
Right.
So definitely deficiencies do play a very big role when it comes to mental health.
Yes.
So I would strongly recommend people, either they go to a doctor and start with some
Correct.
supplements, or I would recommend them to come to you, and they would
Yes.
be eating healthy,
Yes.
more healthy food.
Yeah. Definitely, I recommend everybody get your blood work done at least once in 6 months.
Yes.
So you understand where you're standing, and then whatever there itself you understand. Okay, this could be the deficiency. So what are the common nutrients that you can just pinpoint and say, okay, definitely get these tests done because this could be linked to certain mental disorders.
Yeah, so that is, like I mentioned before, B12, hemoglobin, iron, D3,
D3,
also magnesium.
magnesium.
All of these are very, very important, and then you go for omega-3, even thyroid is very, very
Yes,
important.
so getting the thyroid panel testing done
Yes.
is also extremely important.
Yeah, all thyroid
Yeah,
tests.
yeah. So just to sum it up, it would be hemoglobin, that is hemogram, then ferritin probably.
Yes.
Then apart from that, they could also get a magnesium test done. But I think women over 40 can just simply start taking magnesium supplements, or adding magnesium into the diet, because that generally helps in better sleep, better muscle
Yeah,
recovery,
yeah.
and also in the perimenopausal phase.
Yeah. Many a times, like magnesium, B12, when they are causing fatigue or low enthusiasm, low motivation.
Correct.
So that is when it can be misdiagnosed or labeled as that they are lazy.
Correct.
Lazy people.
So true.
So we should be really careful. Like whenever I'm working with parents, definitely I would really want to pinpoint that maybe it is not just the laziness. There's much more than your wife being just lazy or your son being just lazy.
Correct.
Also, there's one tip I always keep telling, that whenever you are doing tax, that is when you do your blood test.
Okay.
So whichever month, whenever you file your tax, that is the week you do your blood test.
Oh, really?
So every year we should
you
be
do it.
getting. I myself get deficient on B12. So usually I am on,
Correct.
every year I will get it done.
Yes.
I would recommend that to everyone, because like I said, most of 70% people I work with are deficient.
Yes.
And probably Indians have the tendency.
Okay. So you mean to say even children, you see a
Yes.
lot of deficiencies in children as well?
Yes.
And simply by taking care of this nutritional deficiency, a lot of problems get sorted out.
Yes. So
That's
you can feel
amazing.
more motivated, more enthusiastic, maybe more disciplined, determined, consistent. There are so many things,
Okay.
positive with just having
Okay.
your whatever.
So it's just not that the child is lazy, but the child is deficient.
Yes.
That needs to be understood.
Yes.
Yeah, that is so
And there are
important.
so many times that people have come, I have just asked them to do the test. They've just gone to their doctor, started with some supplements or some nutritional plans, and they have never come back to me.
Okay.
So
That's just
that's the
amazing.
beauty, yeah.
Yes, that's the beauty of
Yeah.
it. Yeah, so just then moving on to the next question I have for you is, I am a gut health nutritionist. I have started working with people having gut issues, like, a lot of digestive problems, acidity, bloating, even like, more serious ones like IBS. And I have realized that, all of it is not just related to food habits, but there is a lot related to, probably stress levels, probably some underlying mental health issues, not maybe serious ones, but probably, not just able to sleep well, not just able to handle the stress well, maybe a death of some close person in the family, which gets into the subconscious mind, and then that probably is triggering this. So what is the relationship between these digestive issues and mental health?
Yeah, so first point is that, like I said about deficiencies, 90% of the people coming to me will be complaining some issue with digestion, some issue with hunger, of course sleep, which is again a separate part. So everybody who's going through some mental health related any disorder, like be it depression, anxiety, schizophrenia, any eating disorders, they all will be going through something to do with gut.
Okay.
So like it's very obvious, like how we say that I felt butterflies in my tummy or like in my gut.
Correct.
Or my gut is wrenching. So
Yes.
all of these words probably come from there. That's what I believe in. So this has been there for ages.
Correct.
It's just that we probably are now tapping it because probably mental health professionals were only busy focusing on mental health.
Correct.
Nutritionists were only focusing on gut. So now I feel this goes hand in hand.
Correct.
Actually, and we don't know which comes first.
Yes.
So that is another
Yes.
tricky thing.
Yes.
So it's like so I have digestive issues. So maybe I'm going through stress, or then I have stress. That's why I'm having the digestive issues.
So Neha, would you like to share some story of any of your clients, whom you felt like, this person is having this kind of a digestive issue, and it is not just related to food or nutrition, but it's beyond that.
I work with a lot of people who have anxiety.
Okay.
So I really love working because I feel that's my forte, and I have had many success stories with anxiety disorders.
Correct.
So most of the people with anxiety will have either issues with bloating, constipation, loose motions like diarrhea, or sometimes it's just the sensation.
Okay.
Nausea.
Okay.
Or
Correct.
then there are phases when they will be feeling anxious and then they'll be feeling nauseatic.
Okay.
Sometimes people actually go and vomit, sometimes they don't vomit, they
Okay.
just feel like they will be vomiting.
Okay.
But then that so much hampers their day-to-day functioning.
Quality of life.
Yeah, so imagine a 28-year-old boy, a young boy who's just starting his career, trying to establish into his career, trying to get married, and then he has to visit the loo frequently.
Oh.
And when there's nothing happening,
Correct.
actually, it's just the sensation. I'm keeping my mind occupied.
Correct.
That I have to go and visit the washroom.
Correct.
I have to go and visit the washroom. I cannot focus on anything. I cannot be very productive.
Correct.
I cannot be probably successful.
Correct. Correct.
So that is a big issue right now. I see with people a lot of diarrhea, even frequent urination.
I think bedwetting also comes into a part of that.
Yeah, but then that's again
Fear, more to do
starts
with fear.
trauma, childhood traumas,
Correct,
or
correct.
there can be many more other health reasons
Yeah.
with children.
Yeah.
But
So,
this
can
is
you-
about adults, like mostly when
Yes.
I'm working with. These
Yeah.
are this is the kind of cases I see where a 23-year-old girl is worried about, and then she has to take care,
Correct.
be ready that anytime I have to visit the washroom and keep it clean, keep it. So that's so much of fear and
Pressure,
anxiety,
yeah.
and
That
then
is so true.
we don't know. So which started first?
Yes, that's so true.
So that's a vicious cycle.
Yes, yes. So just to put it in layman's language, can you just explain what exactly is anxiety?
In general, if we say anxiety is a very broad, disorder spectrum. It's a big spectrum. So there are disorders which are very specific. So I fear a very specific thing, and then there are people who are always anxious.
Okay.
So these people who are always anxious are more disturbed, more worried. They would be even worried about the traffic. They would be worried about, oh, I missed my tablet. Actually, they can just go to a shop and buy a medicine.
Correct.
And have their medicine. But if they have missed it, their mind does not work into the solution mode.
Correct.
They're always in the problem mode. So they're
Correct.
more talking about the problems. So imagine if you're stuck in traffic. So then what is my take? That okay, we have to wait here just maybe I'll listen to music, talk to someone sitting next to me, but then these people will be very much
Anxious.
worried.
Yeah.
Worried. So it's
Worried.
more of worry.
Worry, huh?
So then when we talk about the specific anxiety disorders like phobia, panic attacks, so they are again different ones.
Okay.
So panic attack still is very mysterious thing that there's no scientific reason that I saw a tiger, that's why I'm worried, or that's why I'm scared.
Correct.
The panic attack just happens to people.
Okay.
Or fear and phobias also, sometimes we don't know where it is coming from. Like there are so many times that people are not even exposed to the situation which they fear. So it does not come from somewhere. It just randomly, probably, it's very difficult to find out. Sometimes we can find out, sometimes it's undiagnosed.
So then how do we treat, any success stories? Like how would you treat a person having anxiety? Meaning what is generally the modus by which you operate,
Officially or like academically, I am a trained CBT therapist.
Correct.
But as I grew into my practice and as I was like just more interested in other modalities, so mindfulness is one practice which I have come in connect with, and I have been actively following it myself, and I would recommend to everyone.
Okay.
So now my modality with my work is always CBT, mindfulness, and it's client-centered. So it's more of what my patient wants, what they want to do.
Okay.
They want a relief, they want a fix, what they want.
Okay.
CBT is more about you working with their thoughts. Like,
Correct.
so when we say depression, anxiety, or any other mental health related disorder, it's all to do with how you think. So maybe I can, if I'm not able to go straight, I should be, giving myself that time, taking that pause and think that how else I can go.
Correct.
But then that doesn't happen.
Correct.
So we are only thinking in black and white. Is it yes or no? I can go or I cannot go.
Okay.
So that is the kind of attitude we can call, or the way we think. So that is what is more CBT about. It's about how you think.
Correct.
And mindfulness is, I feel it's more of the being aware of yourself, people around you, things around you. Just, it can be just any, where you're sitting.
Yes.
It's all of
Just
that.
being aware of things happening around you.
Living very consciously.
Correct.
So that teaches mindfulness, and CBT goes very well when it comes to anxiety.
Okay.
So because people learn to slow down. That's my mantra, by the way, slow down. So whatever you are doing, so multitasking, be it multitasking or trying to accommodate too many things in a day, doing multiple meetings, multiple projects. So I understand that we need to be ambitious, we need to be making money, we need to be working on ourselves to grow, learn, but at the same time, not at the cost of that we are stressing about that I have not learned this, I have not done this.
You don't enjoy the moment.
Yeah, exactly.
Yes.
So it's the mantra is to slow down.
Correct.
That is what I feel works with anxiety very well.
Correct.
So when people learn to, so like when I said that I don't know if I'm lost, that is one thing. What I should be doing is just sitting here and thinking about it, or just taking that pause that okay, I'm stuck here, accepting it first. Rather than just going, panicking and calling people, or, just checking on Google Map, just watch yourself, how you're
Meaning
feeling.
be aware of that moment.
Yes.
And then take the next step.
Exactly.
Next logical step.
Yeah. Or more solution focused.
Yes.
So I would like to call it more solution focused. That is again one more mantra. So
Yes.
you should be always, thinking solution. What is the solution? There is always a solution.
Yes.
There is always other way. If we can incorporate that in our daily life or our daily, we can make it like a lifestyle. Definitely, it brings a big change.
Yeah. So now, that you're talking about this, I'm just thinking like, there are so many people that I see around or a few clients who might just visit me. They are so anxious and worked up about their, the way they are looking. They might just have a perfect weight. They might have perfect height for their age. But still there's something that they are anxious about. And I think this happens with a lot of female population, that they are never happy with, whatever body shape they've achieved, whatever efforts they've put in, they have got some results. But I don't think they are ever happy about it, and then they want more towards it. So can you just explain a little more about, why this is happening a lot more these days?
Because that is how we are taught to look perfect, to look beautiful, to look, slimmer, in a perfect shape. And if you are not even an inch here or there, you are not acceptable.
Yes.
So
To
it's all
yourself
about
first.
acceptance.
To yourself first.
Yeah, but it comes from also outside. A lot of it comes from outside, definitely. And
Maybe.
of course, if I have created a definition of being healthy, fit by being very muscular or having the six abs or all of that, definitely I'm not going to be happy in my own body,
Correct.
in my own skin. So there are two ways we do this. One is from outside
Yes.
and one is from inside. So outside, I think outside comes first because we are not born that way.
Correct.
This is born very, what do you say? Very
No thoughts, nothing.
genuine.
Yes.
Yeah. I mean, we just trained, we are conditioned that way that to look perfect. And of course, again, I would not blame the marketing or the brands or things, pushing things on us. So that is one thing happening around us.
Yeah, that's so true.
So
So how can you help, how can one love themselves unconditionally or whatever shape you are having? There is some or the other flaw we always find in ourselves.
Yes.
So, how is it that somebody can learn to love themselves unconditionally? I think that has become very important these days.
And there's a very long process.
Yes.
And very slow process. So this starts with, you standing in front of mirror every day, every morning while you're brushing your teeth and, talking to yourself.
Okay.
So that's when it starts probably, or when you go to bed, before you bed, you talk to yourself. So if it's all about how you talk to yourself, that matters actually.
Correct.
And most of the time, if we see people are not talking.
No.
So nobody's saying, oh, you look fat.
Yes. It is
There are
you
very
that
few people, of
Yes.
course we would have some people, but most of the time we are surrounded by good people.
Yes.
Or most of the time our friends would not mind that if I have put on few kgs.
But you
they
cannot
won't mind.
accept yourself.
Yeah,
then.
so it is about me not accepting myself.
Correct.
So again, the mantra will always be like eat healthy, make movement. So I believe a lot in movement. So I believe then if one day, even if you missed out something on your nutrition, you make sure that you moved enough.
Yeah.
So be it exercise, be it yoga, whatever you enjoy doing.
Correct.
That is one thing we should add every day. That also helps the mental health,
Yes.
by the way. Because
Yes.
that's again one more mantra I would give to everyone. So there have been people, maybe some critics who would talk that, she just said that you go for walks every day. But that is the mantra. Why are we looking for a magic?
Correct.
That is the mantra. You go for a walk and you will have beautiful hormones, you will have beautiful skin, you will feel good all day.
Yes, sir. Yeah. I've got so many clients who tell me walking doesn't help. I mean, come on. Any kind of a movement is going to make a difference. I mean, look at your community.
Yeah.
It's just walk it out, talk it out. And
Yes.
the kind of building that you've done for the community is just people are walking.
Yes.
And seeing fantastic results.
So that
there.
is how it starts, that my belief in the movement.
Yes.
So even when you're home, you can be moving, be active.
Yes.
Basically.
Yes.
Rather than, just sitting in one place for hours. So like my job is sitting most of the time. Even probably your job is
Yes.
you are sitting most
Yes.
of the time.
Yes.
But we making, sure
Make
that
it
we
up.
have done our share of movement.
Yes.
Which is good enough to keep us fit.
Yes. So that's what even I feel, nutrition is not always about 100% eating right. It's 80% eating right and 20% do go wrong because you want to socialize. That's a very important aspect of your
Yes.
mental health.
Yes.
So, because somebody who is into so much of exercise and so much of, discipline, somehow they tend to lose it at
Yeah.
some point in time because, they are not able to balance it out and then, they burn out.
Yeah.
So I think that also becomes very, very
That happens
important.
to everyone. It happens to me. It happens to everyone that there are days when I'm feeling too good and I would go and, do a lot of walk or do something. And then there are days when I'm not feeling okay.
Yes.
And I just should be okay with that.
Accept it.
Yeah, that
Not
I'm not
doing
feeling
anything
okay
is also
today.
okay.
Yeah, so sometimes it's okay to sleep little more, get that extra sleep or, be with your kids, be with your family at home in the morning and not just rush for something which you have committed to.
Yes.
So
yes.
that is also a part of mindfulness again.
Yes.
That's discipline with some more flexibility.
Correct.
So that is like when people, most of the time, this is a question comes to me that how do we keep consistent about something?
Yes. Yes.
Or how we feel confident enough about, achieving or being determined about something. So that's when this is what is my take on it. That if you are too disciplined, I'm sure you're going to break.
Correct.
But if you have a little bit of flexibility, little bit of compassion to yourself, that okay, I am a human, even I can miss my run in the morning some days, or when I want to really just watch a series or episode in the night, for entertaining myself. And that's not as bad.
Yes. Surrendering to the right feeling.
We are just trying to be, sorry to say that, but we are trying to be very fit, healthy, eating healthy, and we are just pressurizing ourselves, and that again is affecting our mental health.
Yeah, it goes beyond a point for some people. For some people, it is the other end of the spectrum.
Yeah.
But for the others, it just goes to the other end of the spectrum. Orthorexia is also one part of it, where people are so much determined into only eating healthy that it affects the mental health.
Yes.
So
and
then
this becomes a disorder as well.
Yes. So let's just talk about that now.
Yeah.
So I would say that in my practice, I have seen only a few that I can, count on my fingers. People having eating disorders and realizing that it's an eating disorder, and then trying to seek help from a nutritionist. And then, then beyond that, then we forward those people to, the necessary counselors or psychiatrists. And then it's always a teamwork put together. So I would like you to tell everybody who are watching this of what exactly is eating disorders, what are the different type of eating disorders that exist, and then we will move on to the next question of how it can be tackled with.
I would say again, in layman's language, anything extreme if you're doing, and if it is affecting your body and your mind, definitely it's a disorder.
Correct.
So even if drinking too much of water probably is not so good, or like you eating too much healthy, not satisfying your taste buds. So that's what I have liked about your nutrition plans, that they are very more homely, friendly, nothing very exotic, nothing very fancy. So which we can do every day.
Yes.
So probably that is one thing. But when we talk about eating disorders, there is extreme. Either people are eating too much, or then they are not eating at all.
Okay.
So most of the time when we talk about depression, people don't eat.
Okay.
And then there are also times when people can eat, like they can eat 2 pizzas.
Okay.
Yeah.
So you mean to say like it is like both ends of the spectrum, where overeating also becomes like a disorder?
Yes.
Okay.
Yeah.
Okay.
So the whole point of me, rather than labeling or rather than we calling it a disorder, it's very big spectrum.
Okay.
So like most of the patients with schizophrenia, they would eat more, most of the time. And then there are also times when they would not eat. So what depression does to them is that it would not, so when we talk about anorexia or bulimia, all of these disorders, they always come with depression. So when they are coexisting, so depression is actually causing that person is not motivated to eat.
Correct.
So what does that mean? So for you, ordering a coffee, making a coffee, or for me, making a breakfast is easy. But because they lack energy and motivation, they would not be able to, pick up their own coffee.
Okay.
So what would they do? So if I'm not able to make healthy choices, if I'm not able to organize, plan my meals, if I'm not able to do that, then what do? I rely on Swiggy.
Yes.
I rely on ordering food.
Correct.
Because that's the easiest thing I can do.
Correct.
So that's when we are talking about eating disorders, these are the people in between.
Correct.
So most of the time it is about the lack of motivation when it is mental health related disorder, and that's when the food habits change. So we make wrong choices.
Okay.
So who will make khichdi? Rather I would just eat some bread.
Correct.
That's easy.
Correct.
And
finding the easy way out.
Yeah, because
Escape.
I don't, and that's not their fault. Because like for us, moving around, picking things, lifting, going for a shower is very easy, but somebody who suffers from depression, getting out of bed is a big job. I have had people who suppose are up at 7 o'clock, they would not come out of bed until 10, 11, 12.
Okay.
They're just there lying down, trying to motivate themselves.
Okay. Yeah, and I know they want to push themselves, but they find it very, very difficult. They break every now and then.
So all of this then applied to food.
Yes. So what are the different eating disorders that are commonly seen in India?
Anorexia and bulimia is like they are the very common disorders.
Yes.
Apart from them, like we discussed, IBS is there.
Yes.
There are also very mild level of eating habits which
Yes.
people go wrong. Like even we can talk about addiction here, like cravings. So that is one more thing happens to people.
Even one more thing that in fact I had got a client who was a lot into binge eating. Okay, so of course she told her parents, I want to go and see a nutritionist because I am facing this particular problem, which is binge eating. Now what happens in binge eating is, like, initially this is what started with her. She started watching a lot of YouTube videos where she started seeing a lot of eating healthy and recipes which were healthy. Started making those recipes and started consuming only those recipes, and started watching videos further on which are teaching her how to make food more healthier. Ultimately her grocery list really narrowed down, and then she started relying on very less choices. Later on, her body could not accept that. Her body started demanding more food for survival. So she started binge eating. So what happens is, there are points where she doesn't eat anything at all. That was happening. Now she is, I think, much better, doing well, recovered, because it was like working together with a psychologist and a nutritionist. But then she never used to eat. And then she used to eat excess and couldn't stop eating because her body was asking it. That is the binge eating. So I think anorexia is something where they don't eat at all.
No.
Bulimia is something which they eat everything and vomit out.
Yes, they purge, or
out.
they try to eat or drink something which will make them vomit.
Yes.
Or they just, that's one.
Yes. Binge eating is one more thing.
Yeah.
And I think IBS is on the cusp, like, it could be like something like an eating disorder, but more to do with anxiety and depression.
Yep.
Correct me if I'm wrong.
Yeah, so most of the, again, this is a mystery disorder because it's not known. It's so if you send them to a gastrointestinologist, he will do all the colonoscopy, this,
but still
they
don't find cure
but there's
to it.
Nothing happening. They would come to me most of the time. So this is my very regular assessment, when the first thing I would do is, how do you eat? So sometimes people are very shy to accept that I have this sensation to go and go to potty. But then there are people who would come, they would just say. So there's a lot of shame also attached to it.
Yes, so
that's
much.
Like, again,
so much.
So like I told you about a 28-year-old man, it will be such a shame to tell anyone that this is what is my problem. So that's why this disorder goes undiagnosed.
Okay.
Because the person is trying to just cover it up with something, just being themselves, not sharing it with anyone. Most of the people with IBS, it's all about anxiety.
Okay.
Yeah. So they are hypersensitive, hyper anxious. They might even sometimes have phobias, panic attacks. So all of this together is what causing issues to their gut.
Correct. So now tell me, people with eating disorders, if they are listening to us today, how do they go about it? What will be the first step that they need to take?
I think accept, share, learn to share, at least tell your friend, somebody who will help you to, guide you to a professional, or, just, you yourself refer them to a professional. That is the first step, the acceptance.
Yes. I need help.
Yeah, I need help. Yes. I need to accept, and there's nothing wrong. If my leg is broken, I do go to the doctor.
Correct.
Right. But if I'm having IBS and if I'm facing some issues with going to washroom, it is very difficult to share.
Correct.
So it's just
or even anorexia.
Yeah.
It's very difficult to first understand that probably I have this problem, and then going and seeking help.
Yeah.
So I think accepting, understanding, and not just Googling, because that again becomes dangerous, because then they try to look out for own solutions.
And that will create more stress.
More stress and more problems.
Also, I would say it's all about awareness, which should be around. So if my daughter or if my husband or if my friend is going through this, probably if I know, that would be much helpful. So spreading more awareness rather than hiding it under the blanket. We should be talking more about such disorders, especially IBS.
Correct. That's so important.
Yeah.
So now the next question, very important, is what is depression?
So like for normal people, of course there's a hormonal thing going on, that they are creating more stress hormones or less of serotonin or all of that. I mean, there's a clinical part of it. But in general, if we say, so like I said, that if you want to lift a bottle of water, you do it easily, right? You don't think, you sit there and think for hours that I want to drink water. That is depression. That is so sad that I cannot help myself.
Correct.
Yeah, and they are very not motivated, lack of interest, sleep disturbance. So everything comes then.
Yes.
The sleep disturbance, eating disorders are sometimes following depression. Performance issues. So most of the time, if you see someone who's not going to school every day, or they take a lot of leaves from the office, probably HR should refer them to a therapist.
Correct. It's like just being aware.
Yeah.
And just observing people. Maybe family members can just be observing, you know, people like, is it something different that is happening to my loved one?
Yeah. So and it's not about just being lazy.
Yes.
Or it's not just because that her mood is always off.
Correct.
But it's always about, it's also a lot of sadness they carry. So like maybe watching a movie or watching maybe a comedy show, it can make me happy, but probably it would not make them happy anyway.
Correct.
So they'd be just sitting and watching it.
Correct.
So there's a lot of brain fog, there's a lot of confusion, there's a lot of low self-esteem, and very gloomy kind of sadness which we cannot imagine.
Yes.
So
does it require help of both a psychiatrist and a psychologist then?
Yes. So I think there would be like, I mean, if we put it in two parts, like one is a very clinical depression where there's only therapy doesn't help.
Correct.
People might need help with from a psychiatrist, start with some medication, then get into therapy.
Okay.
So then at the same time we are targeting the clinical side of it, and at the same time we are targeting the I said, the thought process, the lifestyle, the behavioral issues, or anything, just helping that, okay, I'm not able to find job, what do I do?
Yes.
So it's not like a rocket science that I have to go on a LinkedIn and do it.
Yes.
But then I'm not able to do it.
Correct.
So just little bit of motivation.
Yes.
That is what will help. Also sticking to the medication.
Yes.
So
I think then that is where people around you need to intervene and just help you out a little bit.
Yes.
Yeah. So can people really come out of it, so there can be a ray of hope who are listening to us?
Definitely. That is what is my goal, of my life, that if I can help people without medicine, but then at the same time there will be times that I would strongly push people, okay, you need medicine, you must go. So there are a lot of, again, taboos about going to a psychiatrist. So people would come to me, but they would not want to go to a psychiatrist.
Correct.
So the moment I say that you have to take medicine, I will refer to a psychiatrist, they would never show up.
Correct.
So now I take a lot of time to refer people, but then that has worked well for me.
Yes.
So as
I
long
think just understanding that a psychiatrist is just any other doctor, just like a doctor who treats a physical ailment, they are just helping you out, sort out whatever is happening in your mind.
Yeah, they're working on your symptoms and any chemical imbalance, hormonal issues going on. And there are also some psychiatrists, they would also talk. But of course, that I am trained into it. Probably they are not as much as trained. They are more busier, or they are more focused on the symptoms. So that is where I come in picture, but it goes hand in hand.
That's so true.
Yes.
Now that comes to my last question is, we talked about several eating disorders. We talked about, anxiety. We talked about depression, nutritional deficiencies. Now we know about all of this. So how does one break the cycle? Very, very important. So, it should not happen. You try, you take an effort, you try, you work on it, but then again you fall. It should not be a vicious cycle.
Yeah.
So how does somebody break the cycle?
It's a vicious cycle. We already know it's like egg or chicken first. We don't know. So we have to work on every aspect of it. So taking small steps, like I said, being very conscious about what you're doing. Mindfulness definitely works. Coming to therapy and going to a doctor will also help, but being, more aware of yourself, being connected to yourself, that what is happening to me. That we live in such a busy life right now that sometimes we are hungry, but we don't know.
Correct.
So we just irritated. I'm shouting, screaming at people, but then I don't know that I need some water, I need to eat.
Correct.
So it's all about slowing down. That is the key to breaking this cycle. So this slowing down also will help that, okay, my friend is sitting next to me every day, but I don't know what is happening around her life, or I'm not aware of it. I don't observe that she's sad today, or she's happy today, or she's not come to the office today. So being more connected, being more aware of
becomes very, very important.
So building that connection with yourself, your body, your mind, and then also people around you.
Correct,
So
correct.
even if I can do it this around my near circle, like a very close circle, we all have our own circles.
Correct, correct.
So we can be really a healthy community.
Right, right.
Yeah.
And how about, using certain mindful practices? What is your take on it? Like meditation, probably, and other things.
Yeah.
So what would be your take on it?
So now when we say meditation, so imagine like somebody who comes to me, they're already disturbed, they are in depression or they are anxious, or when it comes to couples, they're already fighting, or when they're parent, or like whatever people I'm working with, they're already disturbed. So if I tell them, so there are also times that at the end of the session, like very first session, the woman would ask me, you did not tell me to do meditation. Yeah, so that's a very much, I like that question, because there's a lot of awareness about meditation and all, but you don't necessarily have to, build that practice of hours to sit. So even, now and then 1 or 2 minutes, if you can find out to just sit without phone, without screen, without anybody disturbing you, it can really work wonders. And then when you are feeling little better, then that's when you maybe start to practice 5 minutes sitting down, 10 minutes sitting down.
Correct.
When it comes to anxiety, breathing exercises do help. But again, if I start to tell them to do pranayam, or if I tell to count this and exhale this, it becomes very, very, very challenging.
So I understand what you're trying to say is, when a person coming with these problems, first they need to tackle these problems and support it with mindful meditation, but not look at meditation as the maybe the only solution to the problem.
Exactly.
Which happens with a lot of people. They feel like, when they start calming their mind, their problems will get sorted out.
Yeah.
I also do a lot of mindful meditation, and I recommend that to a lot of people, but for different purposes altogether. Like if somebody has got IBS, that mindful meditation of 3 to 5 minutes in the morning is just going to calm and enhance the parasympathetic nervous system.
Yes.
Is what we are trying to do there. But certain severe cases of anxiety and depression do need intervention, and then followed by this kind of mindful meditation which supports it.
Yeah, so exactly,
Yes.
when people are coming to me, the damage has already been done. So when we talk about meditation, it's more preventive thing. It's not, there are like, I have seen people who have come with lot of meditation. They say that I sit for 20 minutes, I sit for 40 minutes, but my brain doesn't stop. So it's like very simple. Means I would always tell this to people, that if you walk into a kitchen and if it's in a mess, would you be able to cook a good meal? It'll be very difficult. So clear out the clutter first.
Correct.
Yeah, and then work on the cooking.
Correct.
Or then you talk about the ingredients, or you talk about the fixing a meal.
Correct.
So definitely meditation is very, very helpful. I will never discourage people to do that. But start with just little practices. Don't force yourself to sit for 20 minutes and I'm not able to sit. So that is a...
and a lot of times it so happens people do not understand the real way to go about meditation. A lot of times people feel like thoughts nahi aane chahiye. You should not get...
Exactly.
That is so wrong.
That is so wrong.
It is that you are aware of your thoughts. It's like you're watching your thoughts, like how you'll stand in the balcony and watch the cars go by, and then focus and come back to the presence.
Yes.
Or the present.
Yes.
That is what we talk about meditation. We don't talk about not letting the thoughts come in, which is not the right way of meditation. So they'll sit even for 20 minutes, but then they say my thoughts keep on coming. They are supposed to come. You cannot stop the thoughts, but it's the way you channelize it.
Exactly. So it's about, I would say it's all about lifestyle.
Yes.
Living that mindful, bringing in that mindfulness practice every day, rather than just practicing breathing or practicing meditation or trying to... So you can actually do it anywhere, basically.
Yes.
So the whole idea is like, I would like when I am working with mainly people with anxiety, what I would recommend them is that in between your meetings or every 2 hours you can put an alarm. If you want to do it in a structured way, then put an alarm, because there are people who would want it structured way. And then there are people like me who would just do it anytime. So I would recommend them to just sit. Don't do anything. Just sit.
Yes.
It's okay. Whatever thoughts are coming, whatever is happening to you, just be there.
Correct.
Just learn to sit still.
Yes. That's so
without
important.
doing anything.
That's so important. So, where meditation specially works for my clients, the one who have got inflammation, the ones who have got IBS, other digestive issues. But then this is what we recommend, doing that first thing in the morning, getting up, sitting up in the bed. Basically, you are just, changing the brain waves and calming your mind so that the rest of the day gets okay. But yes, under severe cases, I think you need to tackle the problem first.
Yeah.
And then get into that.
Little bit of, like I said, decluttering of
Yes.
whatever issues are.
Yes.
And then when you learn to sit 1 minute
Yes.
with your thoughts,
Yes.
or you can just sit with doing nothing. That's when you then start to practice meditation.
Yes.
Start with very little time, like 5 minutes, then you build on it slowly. It can take 1 year for you to get to 20 minutes of a good sitting position. So sitting meditations are great, but there are other things also you can.
Yes.
There are so many people.
Yes, and it should be learned from a guru, or from a person who can teach you the right way. Very important. Very important.
You should know what you're doing.
Yes,
Yeah.
you should
So
know.
if you don't
and
know,
you should know the reason why you're doing it, then you are more convinced as to why you're doing it.
Yeah.
I think that holds good for everything, nutrition, psychology, everything.
Exactly.
That's
so you should
true.
know what you're doing.
Correct.
You should know the gist of it. You should know the root of it. That
Correct.
just don't do it just because you saw a video, or because your friend is doing it and she is feeling good. So it's not like one fits all kind of thing anywhere. So be it nutrition, you do very personal chats, I do very personal sessions. So it's all very personal when it comes to health.
Correct.
So we cannot be comparing and fighting for that, like why am I not able to do it? So she went to Everest, but I cannot go to even a little hill around my house. So we should not be comparing.
Correct.
That is one thing. Just be very individual. Be connected to yourself. Seek help as soon as possible when you feel like there's something wrong. It's always good to go to a therapist, a doctor, or a nutritionist in time.
Yes.
Rather than damaging it more.
Yes, that's so true. So Neha, thank you so much for being here. It was totally insightful. We spoke about so many things. We spoke about eating disorders. We spoke about anxiety, depression, nutritional deficiencies, and how a role of a psychiatrist, a psychologist, a nutritionist works together in getting all this sorted out. I hope the listeners will be able to take in the message that we are trying to give to them. Thank you once again for taking out time today.
Thank you for having me. It was wonderful talking to you.
Thank you so much.
It went very well, really nice.
Thank you.
Yeah. Thank you.